is sending you welcome today also to take a Zoom. So not that we actually use the bigger Zoom, but definitely have a better than me running the AV from up front too. So there's a whole lot of benefit coming out of this. So. Well, good afternoon. Welcome. My name is Lee Acey. I'm the director of the Mayo Clinic Center for Social Media. I'm glad to welcome you who are here in the room, as well as a potentially global audience to our second social media grand rounds. This is the first one that I think we're going to get right. Just from the, we had a little streaming issue last time, and so this time we're glad to hopefully have worked out the kinks. So with that, I would like to ask Jean Dankbar, who's part of our internal advisory group for the Mayo Clinic Center for Social Media, to come and just say a few words about his idea and how this related to getting started with social media grand rounds.
Good. Thanks, Lee, for the opportunity there. This is an idea. I'd been a member of the internal advisory group for the last 6 months back in 2013 or so, and listening into the discussions, thought about if there's different ways to broadcast this more broadly out to the external world, and I saw the idea for a social media club out of all places of Des Moines, Iowa, that had a social media club going there. I wrote up the idea that maybe we could do something internally similar to that and shared it with Lee and some of his colleagues, and we talked about it late last fall, and it seemed to be an idea that resonated with Lee, because Lee, you've always thought about an idea for a social media grand rounds much along the same lines as our medical grand rounds we hold here at Mayo Clinic. So we had our first session back in February, had a few technical problems, but again, we're hoping today that it goes off well, and we see tweets from, it'd be fun to see them from all around the world, Lee, for that. So it was a great opportunity, and I hope we can keep this going as well with some more guest speakers along the way there. So thanks, Lee, for the chance.
Try and make one of these for some time. Thanks, Jean, and thanks for being part of the planning committee for this, along with Stacey Theobald and Elizabeth Hardy and Jason Pratt on our our Florida campus. So for those of you who are watching the live stream, I'd encourage you, if you have questions or comments, things you'd like to interject into the conversation, use the hashtag MCCSM. And with that, I would just like to have us get into our first presentation, which will be featuring a member of our team and then a member of our team who isn't exactly a member of our team, but is part of our internal employee communications group. So if Elizabeth and Michaela would come, Michaela Johnson is part of our staff for the Mayo Clinic Center for Social Media. Elizabeth Hardy, and you'll see their Twitter handles up there. Elizabeth Hardy has worked with Mayo Clinic in employee communications, and has been a very active member, first of our internal advisory group, but then has devoted a good chunk of her time to being part of our Center for Social Media team. So with that, I'd invite them to come talk about how we're using social media to celebrate Mayo Clinic's sesquicentennial.
Say that 5 times real fast. Okay, so what I will be talking about is how we're using social media to celebrate the sesquicentennial events, and I'll be focusing towards the end of it on the mobile exhibit, but Elizabeth will then be talking about the efforts from an internal communication perspective. Okay, so first of all, I'll just mention that there's a website. Many people may know that already. Many people in the room may have worked on it. And the link is there. That's something that we have not produced, but it'll come up later in reference in a couple of the slides. So before, or earlier on, when the sesquicentennial, or the 150th anniversary of Mayo Clinic, when the year started, we started to post different videos on YouTube or tweet things about Mayo's history or post onto Facebook. And so these are just some generic examples of some of these posts. In this case, It's the video about Mayo Clinic's sesquicentennial. And one of our colleagues on our team, Dana Sparks, has been working on patient stories, and she then posts these on the Mayo Clinic News Network and subsequently on Facebook and Twitter, and then they also end up on the website, that the aforementioned website there. So there's a section on patient stories. This is one of the examples of a tweet that we sent out earlier once the sesquicentennial celebration started on Mayo Clinic's first ad in the Rochester, Minnesota paper. And then one of our colleagues, Joel Street, has been working on a video postcard project for several months, I believe, and it culminated at, many of you may have been at the signature event on Friday night, but many of these videos were showcased there. And so Joel was the producer on this project and worked with many people who shot these videos. And so several different interviews with notable patients and benefactors and supporters of Mayo Clinic. And it was really neat to hear them say, "Happy birthday, Mayo Clinic." So Barbara Bush, the Dalai Lama, Franklin Graham, and Arnold Palmer. So there were many different videos that were shot and will be posted online as well. So specific to the mobile exhibit, which is what I've worked more closely with, before the mobile exhibit started, and many of you may have seen it, it's already been on the Arizona campus and on the Minnesota campus most of last week. But before the exhibit started its tour, I started to post updates on Facebook, so doing Facebook posts, and in this case it was a sneak peek from a colleague in media support who had gone to look at the mobile exhibit while it was being constructed. So before, you can see one of the sides is entirely white yet, which is not the case at present. But we worked together to get content. So in this case, it's a mobile exhibit promo. I also did not produce the animation here itself, but we were able to work together as Mayo Clinic does in an integrative approach and be able to post videos like this onto YouTube and tweet it and post it on Facebook. And then one of our media relations colleagues, similar to the traditional news release, was able to post on the Mayo Clinic News Network announcing that the mobile exhibit was starting to honor 150 years and linking to the itinerary. So specifically for each visit where the mobile exhibit goes, we are posting on Facebook and tweeting when the exhibit enters a new location, and then also sending a tweet when it leaves somewhere and kind of announcing it to where it's going. So in this case, this was not geographically targeted. We just announced the mobile exhibit is getting unveiled and connected it to, with the @ sign, but connected it to the Kingman Regional Medical Center's Facebook page, as the exhibit was going to Kingman, Arizona, and then linking it to the rest of the itinerary. And so this one, this particular post was pertinent to not just those in Kingman, because people could look at the itinerary and see where the exhibit was going, and is still going. It will be touring across the U.S. and Canada, over 40 stops, I believe. And then this is an example of a tweet after the visit. So thanks for a great visit, Kingman. Our 1,000 square foot exhibition on wheels is now headed for Phoenix, with a picture to the exhibit. And in some of these cases, so this weekend the exhibit was at the Susan G. Komen Race for the Cure. And so in those cases, we will put a hashtag that's referencing the race in particular. And so before each post, I will go and look up the hashtag that's being used or the handle that's being used in order to incorporate that audience. And so the idea being those that are following the race, or running or walking, or families that are going to that, if they're looking for information on that we can kind of throw this into the conversation so that they're aware that they could go visit the mobile exhibit at Mall of America. And then what I wanted to mention as well was geographic targeting. So as you can imagine, the exhibit is, sometimes it's going to a new place after just one day, and sometimes after a couple days. Now, all of our Facebook audience, and we have over 500,000 followers, so they all probably do not care each time the exhibit is going to a new location. So say if one day it's in Kingman, and the next day it's in Phoenix, and the next day it's in Scottsdale. That's exciting for the people that could potentially go, but we don't want to alienate the rest of our audience that can't go to each location. And so one thing that I've been taking advantage of is the ability on Facebook to do geographically targeted posts, which is free. So you can do that through advertising as well, but in this case it's just free, which is my favorite form of payment. But in this case here, the exhibit was going to La Crosse, and since I'm from Wisconsin originally, I know some of the neighboring cities better. And so I just threw the screen grab in there to show that when it's going to La Crosse, I knew that the neighboring towns and cities might be able to visit as well, because it might be the closest area in proximity where the mobile exhibit will be going. So throwing in places like not only La Crosse, but Onalaska, Arcadia, Tomah, Viroqua, West Salem. And so people who have self-proclaimed that they're from or live in Tomah, Wisconsin, or Viroqua, confessed, yes. Confessed, yes. I get a lot of teasing about being from Wisconsin, and yes, being a Green Bay Packer fan. But this has been helpful because we don't have to alienate our audience, our entire audience. And some people naturally are internationally where our likes are from, and around the U.S. and in different different regions of the U.S. And if we're going to just look at the numbers, honestly, these posts are going to perform very poorly. Like if you look at how many people are going to like them or comment on them, but the goal for these types of posts is not going to be to get the highest reach, because if that were the case, we would just post it to our entire audience rather than targeting it. We also have been posting pictures on Flickr. Wayne Desborough is traveling with the mobile exhibit, and he's been taking pictures at the different locations and subsequently uploading them to Flickr. And we've been working together around an album called, believe it or not, The Mobile Exhibit, and just showing different images. So, and a couple of these is Governor Brewer in Arizona. And it's a nice opportunity where if once people give permission to get their picture taken, Wayne can say we're uploading it to Flickr, so it's a way for them to go on and see their picture and see the other pictures that are taking place. It's also a great source for me when I want to do future posts on the mobile exhibit, because I have a great collection of images to choose from. And we've also connected with other internal Mayo Clinic colleagues in media support so that they can use these images for historical archive purposes in their image repository. And then finally, I am going to briefly discuss the guest book. So as people leave the mobile exhibit, they can take a card, which is a source, basically lists different ways that they can connect with Mayo Clinic after the exhibit. And on the bottom it says, if you have gone through the mobile exhibit, please share your feedback or what you've learned, kind of the favorite fact that you took away. And that's on the Connect site with the link that was shown there. There's a feed that's brought in from Twitter with the hashtag MayoClinic150, and people can actually, on the bottom there it says tweet to the hashtag. And so it's another reminder of people what the hashtag is, and they can actually tweet it from this page directly. Similarly, we have Facebook posts embedded within this page, so brought over from our Facebook page, and then they can share this post from here. So if they click here to share on Facebook, it'll take them to share that post on their Facebook page. And then there's also a section for, say, if you don't have a Facebook page and don't have a Twitter account and you just want to give your feedback in general, there's a section for that as well, so a commenting section. And something that's been neat to watch is are the different posts that have come in from Facebook and Twitter. Governor Brewer, as I mentioned, went through the exhibit in Arizona, and so she tweeted this on the right-hand side here. Congrats to Mayo Clinic on 150 years of superb service and saving lives. Honored to be a part of the celebration. And she tweeted a picture with it. And then on the left-hand side, it was just someone who was driving behind the exhibit and wondered, what is this? And and they just posted, we saw this Saturday, April 20th, traveling west, right outside of Grants, New Mexico. Please tell us more about it. And so it just shows that it's just an opportunity and shows people that that as long as it needs to be traveling that many miles, why not have some advertising connected to it and show them how to continue the conversation and to learn what it's about rather than just seeing Mayo Clinic's logo or something about the sesquicentennial. So I will have Elizabeth come up and she'll talk about internal communications.
In fairness, I'm wearing purple for the Vikings so that we get both covered here. Yeah. The mobile exhibit really, even though the sesquicentennial is so much a part of our marketing, it's also something for our employees to be proud of. We want this to be a point of pride for our employees and to get them engaged in what we're doing. So the mobile exhibit is going to be making stops not only at our 3 main campuses, but at some of the Mayo Clinic Health System sites between now and the end of October. And I believe next Wednesday or Thursday, it's in Mankato. Oops, I'm going the wrong direction. Thank you. So we have been sharing a lot of the stories of the exhibit, of the mobile exhibit traveling since prior to the trip. We wanted to let people know that this was going to be coming. We wanted to give them heads up so they can plan around it. So we have the Mayo Clinic News Center where people were able to share news, what's going on within Mayo Clinic and at the various sites. We had, I think, probably 5 or 6 stories leading up to it. So we had it telling it's coming to Arizona, it's coming to La Crosse, it's coming to Rochester, May 6th to the 10th. We wanted to make sure we had plenty of our employees there to be able to walk through it. We also did a little traveling. Myself and my cohort, Hoyt Finnemore, went down to Arizona when the mobile exhibit launched to do a sort of video series on what people could expect with it. So we did one called Chasing the Mobile Exhibit, which was going into the first location was Kingman. And fortunately for us, it's right outside Route 66, so we decided to pull that into the theme. And we did one video on the Tuesday. It opened Monday, the 21st. The 22nd, we did the story. The 22nd and the 23rd, it was in Phoenix, Arizona on a campus. So we did another video for that Thursday, which basically took employees through the exhibit, not necessarily giving them point by point, but just enough to pique their interest. We did full stories of giving people where it's going to be in the next coming weeks. We also have been sharing a lot of this on Yammer, which is our internal social network. We've been taking the stories from the news center, taking clips from it, and putting it within Yammer so we can drive people from our Yammer to the site, but also as another way to build awareness of what's going on with it. We've been sharing photos from the Mayo Clinic photographer that were posted on the day of the event. So when we had the ribbon cutting here in Rochester a week ago, Tuesday, the photographer was able to get me the photos probably within a couple of hours, and we shared them in a notebook on Yammer. We've been sharing a lot of these on Facebook. We've been sharing we have employees at Mayo Clinic Facebook account because we want our employees, like I said before, to know that this is coming around to their area. So a lot of the stories that we share both internally and externally, we put on our employees at Mayo Clinic Facebook page. And that's what I have. I'll let you guys go with questions.
Cool, thanks. That was great, and I think one of the things that really emphasizes is that these aren't about social tools in isolation. We're certainly doing media relations and other communications about about these projects, and it's just in making sure we incorporate a social strategy with the other things we're doing. So with that, I would now like to invite another member of our team, Tony Hart, up to the podium. Tony works with our Department of Medicine in the CME courses, and also then, as part of his service with our team, does a lot with our YouTube channel. So let's take it away, Tony.
Hi, welcome. As Lee mentioned, I work for the Center for Social Media, but my main focus is really the Department of Medicine and their CME program. So I get to go around, work with some physicians, and really try to promote their CME courses. So a big thing being in both fields, in CME and social media, I wanted to see how I can combine them and either make the experience better at the course for the attendees using social media, or really just use it to promote the course as well. So we'll do some creative problem solving here. So problem Mayo Clinic is all these fantastic resources, and we really want to say, hey, how can we spread the word for this? So some of the resources we have, anything from the healthy lifestyle, we have a symptom checker. It's a lot of our stuff on our mayoclinic.org page. I mean, we get a ton of hits every year for it. We're one of the most visited medical websites, and we're very trusted online. So we have all these resources. So what are we going to use? Social media, of course, because that's where the patients are. So social media really does work. We've seen that at Mayo Clinic here for our Mayo Clinic account to reach patients. We have over 500,000 page likes on our Facebook page, over 12 million views on our YouTube channel for our videos, and we have almost 800,000 followers on Twitter as well. And that's growing every day, definitely. So we also have all these resources for Mayo Clinic medical professionals inside Mayo Clinic and also outside of Mayo Clinic. Our upcoming courses, we have grand rounds, publications, we have newsletters, we have journals. So we really have all these resources. So I really asked myself, can social media reach medical professionals? We have all these resources. How are we going to reach them? Social media is a great way to do it. So I really just want to pull CME into the social media realm. And this, I just wanted to do a little bit of an interest timeline as well, to kind of see how social media and CME kind of overlap a little bit. Right away, we have our early adopters, really just the people that jumped on Facebook, MDs, nurse practitioners, physician assistants that really jumped on right away for Twitter, Facebook, and YouTube. And then after that, we have the hashtag MedEd, which is the most popular CME hashtag on Twitter right now. That started in January of 2009. And then in 2010, there was a launch of the Social Media Health Network here at Mayo Clinic. Got to plug Mayo Clinic a little bit here. And then in 2011, we started using social media at our CME conferences. My colleague, Michaela, who spoke earlier, she had gone to the Selected Topics in Internal Medicine course and really incorporated social media before and after at the course. She presented at the beginning of the course that she was there to help with social media, and then they also collected questions from the audience as well using Twitter and Facebook, and then Michaela kind of pulled those all together for the audience. She was also on site to shoot YouTube interviews. Word of mouth is a very big deal in the CME community. It's definitely one of the biggest drivers of why people attend our courses, because Mayo Clinic has such good word of mouth. They have such good courses. So she shot some YouTube interviews as well on course of some of the attendees. And then, of course, CME conference hashtags started picking up a little bit. They were much bigger they were usually used for the bigger conferences to start out, like American Heart Association. Really, the larger conferences started using them first, and then some of the smaller ones started to follow afterwards. Simpler became popular in 2012. It really ramped up there, and now they boast 410 million healthcare tweets, 6.6 million healthcare Twitter profiles, and over 10,000 provider profiles, providers being physicians, MPs, PAs. And then lastly, the CME apps really started kicking up as well after Twitter did at these national conferences. And then I'm going to explain a little bit about where Mayo Clinic is in the present on these things. So how have we addressed this trend at Mayo Clinic? I first want to start out and talk about our app a little bit. We just started using an app a couple of years ago. Cardiovascular started one for their CME programs. It was mostly their board review courses, so very large courses. People are there to study, really dive in, look at the PowerPoints that the presenters give, take lots of notes. I mean, they're there to pass their boards. So it started out with the Cardiovascular app for their board review courses, and then the Department of Medicine, who I work for now, they really wanted to try it out too, see how it worked for their courses. So we had we test piloted it for 3 of our courses last year here. Really good feedback and everything. I'll show you the app here in a minute. But we really had one event, one app for each event. So we had multiple CME apps out in the App Store at one time. We thought that was kind of cumbersome. It was harder to find the apps. So we really moved into a model now. We just had a conference that we're under a shell or container app now. So there is a Mayo Clinic CME app out there, and there will be multiple events within there that they can access. I'll show you a quick video here of some of the features of the app.
The Mayo Clinic CME app provides attendees with everything they would normally get in print materials, but in an electronic version. There's a schedule, more information tab, people tab, exhibitor tab, and then social tab as well. If we go into schedule, education sessions, browse by day, and then we'll select Monday here. This is a normal schedule that they would get in the print version. Any of the talks that have the thumbnail next to them have the presentations connected to them. So if I select on one of the presentations, it gives more information about it, including the learning objectives, and then I can click View Slides. It'll bring me right into the person's presentation. I can go back and forth in the slides, and then there's also a pen option that I can actually draw with my finger on the slides. There's also a marker option. That's a highlight. It's a click and drag. And there's also a notes option that I can take notes using my iPad keyboard. If I go back to the main menu here, I'll show you the More Information tab. It's really a great place to cross-promote things. We have our next year's course on there, upcoming CME courses, our newsletter. We also have some activities to do in the location that we are at as well. Just some helpful information for our attendees. If I go over to the people, I can browse speakers, go through alphabetically there, and then if I click on a speaker, it gives some more information about them, and then also connects any presentations that they have there, and I can access the presentations this way as well. There's also a Browse App Users option that attendees can opt into to message each other, much like text messaging or an email system. If I go back to exhibitors, this displays our exhibitors for our course, which would normally be in our print syllabus as well. If I click on an exhibitor, it gives more information about them, and then I can also visit their website. The last aspect is the social aspect. It connects to our Twitter account and our Facebook account as well, so they can interact with the course.
So as you can see, some really neat features there. One of the things that we were really looking for an event app is something that the attendees could really take a PowerPoint slide and connect their points directly to that slide. There's a lot of apps out there that you can take notes for a presentation as a whole, but not connected to a slide. And we found that very cumbersome for our attendees. We didn't really want to do it. Sometimes there's 50, 60 slides in here, so it'd be really hard for them to organize their notes, especially when they're already stressed as it is for a board review course. How do I pull that back up here? Okay. Thank you. Yes. I also wanted to talk a little bit about a new blog that we will be launching. It launched May 12th, actually. Cardiovascular really saw a need to use social media to kind of spread news about their course. This will be for it really started out with the Cardiovascular board review course. So they really wanted to drive attendees to it. They have a great new website and a lot of new features on there, test taking and that sort of thing on there to prepare the cardiologists for their board. So they really wanted to provide more information for their attendees, specific to the board review course to start out, and then kind of more in general for just cardiovascular education. There's going to be anything from information about the course to, hey, here's a new article about this cardiology disease, even if it's Mayo Clinic related or not. So it's really a neat thing that they are taking the time to do this and really see the power of social media, and they want to get on there. There's also going to be a Twitter campaign connected to that as well, so we'll be tweeting about it quite a bit. Speaking of Twitter, I recently started a Mayo Clinic medical education Twitter account as well. It's at MayoMedEd. As I mentioned earlier, the hashtag MedEd is the most popular CME hashtag on Twitter, so we decided to take advantage of that. So I wanted to put side by side our two Twitter accounts here. The one that's aimed at patients, our Mayo at Mayo Clinic Twitter account there, and then also our at Mayo MedEd one there. As you can see, the left one is definitely patient-oriented, and then on the right side, we really want to tell people that it's CME and it's for your education and that it's really aimed towards medical professionals. This came as an initiative because we really do have all those great resources that I showed earlier as well for medical professionals, and I honestly didn't know they were there. I think a lot of people, even at Mayo Clinic, don't know that they are there to the full extent, so it's definitely a great way to get the word out. I wanted to show a few of the tweets up here, just sending out. We have our update for orthopedics up there, and then a few news stories, launching a 50-gene cancer panel. We also have the vaccine era story, which is kind of cool. It's individualized vaccines is what they think the future is going to be, which is very interesting. And then we even have a video case study up there that's more promoting our CME course as well. As you can see, a lot of these are more general information for physician education, and then we every once in a while have a CME promotion-y type thing. We try to keep them more general, as in case studies, instead of come to our course. We really want to provide information to them. Hey, check out our course. This is the kind of material that you're going to see, and check out our course. We have a cool app that really help you, dig down and study for your boards. And that's all I have. Are there any questions?
We can maybe come back to questions at the end and in further discussion. So that was great information to Tony. So let's move on to discussion of what we've been doing with the evolution of social media residency. So social media residency started in our goal of creating social media residency was to create a hands-on crash course for people interested in using social media in healthcare, and with an emphasis on developing strategic plans so that wouldn't be just come and see how cool social media tools can be, but actually developing a plan for how those can be applied within the participants' jobs. We began with a 1.5-day intensive crash course and wanted to keep our faculty-student ratio at 1:8 or lower. So we wanted to have a lot of people able to help hand-holding, so to speak, as they're going through the process. The first one of these that we held was October 20th and 21st of 2011 here in Rochester. It was part of the week of activities that we had in conjunction with the Mayo-Reagan Social Media Summit. And we did use the residency metaphor, but one of the sort of tongue-in-cheek things is that there's no overnight shifts. You don't have to be on call or anything. It's not nearly that intense. We got some feedback that it was still plenty intense. So our feedback was there was a favorable response. Lots of people learned, but we did have some issues with resident burnout. And so we, after 5 o'clock that first day, so we went from about 9 o'clock in the morning until 7 p.m. After about 5 p.m., there wasn't a whole lot more learning happening. And then when we had an overnight writing assignment on top of that, people said, let's just say it was underappreciated. We didn't, the residency metaphor didn't break down, but the participants did. And so the feedback that we got was that we should change this up a little bit. We kept the 1.5-day format, but instead of at 7 o'clock, we ended at 5:30. We did hold it in 2012 twice on each of our campuses in Rochester, Jacksonville, and then in Scottsdale, Phoenix. In Rochester, we moved to the beginning of Social Media Week. So instead of having it be at the end of a big conference, we thought by being able to start fresher, we would also then arm the participants who were participating in the Mayo-Reagan conference with tools that they'd be able to use to engage. So instead of going to the conference and then learning how to use Twitter, they'd come in knowing. So in 2013, we continued our spring-fall Rochester, Jacksonville, Scottsdale, Phoenix pattern. We also held the course in New York City and in Dallas and Seattle to make it more accessible for members of our social media health network. And at last year's Social Media Week, in discussions with our external advisory board, said, how can we improve this further? And one of the big suggestions that came out of that was that we should shorten it to 1 day so that people don't have to have the extra day of travel, of lodging, and just the time away, the commitment required to be a part of it. We moved to some online, or they suggested moving to some online prerequisite modules so that we could get everybody up to a basic level of familiarity before they dove into the course. And that way we could move more quickly once we got into the course itself. And then finally we said, let's offer our Social Media Health Network members an opportunity, the organizational members, an opportunity to host. So these are the prerequisites that we've posted on our Social Media Health Network site. These are modules that, and we could probably make this a little bit clearer. It's not intended that everybody has to go through all the modules, but it's just to have the familiarity with the concepts that are there. And so this goes through things like how to set up your Twitter account, things that you should, some of the basics of, for instance, our history of social media at Mayo Clinic, to provide some context so that we don't have to do that when they are here with us. Our first of these externally hosted ones was in collaboration with the University of Utah Healthcare, and that was last month on April 15th. They promoted it significantly with their employees and the Utah Hospital Association. We ended up selling out with more than 90 registrants. And here is the crowd. So we took the crowd was so big it blocked out the mountain behind him, that and the fact that we're taking pictures into the sun. But within the group, within the room, as you see, we had a great and active group. We got some helpful feedback from them as part of it, though, that we needed to move the metrics to the morning because everybody's brain was still kind of fried by mid-afternoon. And so the most recent of our social media residencies was just this week, was Monday here in Rochester, and we held it over the DoubleTree. This was our group picture. Much more artistically done than the one in Salt Lake City. Planned ahead. There we go. So one of the things that we do as part of the course now is a pre-residency assessment so that we can ask our participants how they rate their current competency with various platforms. And so this is the before on blogging. You'll see that we had an awful lot with no blogging experience or low. We also repeat the test after the survey after to ask how they feel their competency has changed. So this is the before. This is the after. We like to see the movement up and to the right. This was on Facebook. They came in, and this was not surprising. We saw very much the same thing. This is with the Rochester residency. Same thing in Salt Lake City, that the experience with Facebook was fairly significant, which you would expect with 1.3 billion users worldwide. So they already had some pretty significant experience in Facebook, but that even improved somewhat. They reported that improving somewhat just after 1 day of experience with this. With Google+, there was a much smaller movement, and that was mainly because we had a prerequisite module on Google+, but we didn't have an in-course session on it, but still we developed some familiarity. On LinkedIn, as you see, again, a little bit of experience on this, but that was shifting significantly. This was actually after only a 10-minute segment within the course on LinkedIn. They were reporting feeling much more comfortable because we did have some hands-on opportunities for them to adjust their own profiles. On Pinterest, it was pretty flat across the board, and that migrated a little, again, only a 10-minute in-course session. On Twitter is where it really went nuts. Well, Twitter and YouTube. On Twitter, we went from relatively low to, after just a 1 hour, 1 hour session, including their first Twitter chat, people feeling like, well, first of all, there's nobody that said they had no experience because they had that experience within it. But even, they felt a lot more comfortable. Finally, on YouTube, everybody's used YouTube, everybody's watched YouTube, but we asked them their competency with shooting and uploading videos. You see we had a significant group that had none, and after our hands-on experience, that had moved significantly to the right as well. So in Salt Lake City, these are the before and after competency scores. You see particularly blogging, Twitter and YouTube had significant gains along with Google+. But whereas before the session there was no platform that was above 3 on that scale, on the average competency scale. Afterwards, actually there were 5 of the platforms where people felt significantly more competent. Likewise, and actually it was even somewhat more pronounced in Rochester this week. If you look at the blogging, the YouTube and the Twitter, YouTube is particularly, this is the before and after, or the net gain in the post-course competency. So in blogging, well, the reason you would see that with Google Plus the gain wasn't as big is because during that one we didn't have, this week in Rochester, we didn't have a session devoted just the prerequisite. But with LinkedIn, with Pinterest, with Twitter, with YouTube, with blogging, significant gains in self-reported comfort. We also then asked them to review or to give us a view of the value of each of the elements that was included. And I take I take pride in the one on the far right, that the fact that we listened to the feedback when we moved metrics to the morning meant that people's brains weren't fried when we were talking about math, and we were able to have them feel more comfortable with it. But as you see, significant value seen, particularly in the hands-on ones. So the video, the Twitter, and the blogging, that those were the top 3 in terms of usefulness, and in all 3 of those we had some hands-on exercises where people could develop that comfort. Our future plans, we are going to continue to refine the program based on the feedback. So as you see, this last time we took that feedback from the Salt Lake City course and were able to continue to improve it. We have some upcoming sessions scheduled. So for those of you who are in Arizona, September 15th will be coming your way. We'll be doing it October 20th as the first day of Social Media Week here in Rochester. And then in November we'll be in Jacksonville. We're working on a program called Virtual Residency, which will be more like a month-long course and with phone call-in. And also are in some conversations with some other groups that are interested, our network members interested in hosting the program, and so we'll have announcements on those in the coming weeks. With that, we are at the end of our scheduled time, and we are right on time, so we'd allowed for 45 minutes of presentation and the rest for question and answer. So we've been inviting those who are participating remotely to tweet their questions to MCCSM. Because I've been in the middle of presenting, I haven't had my eyes on Twitter. So if someone here sees a question that's been raised and would like to ask it, go ahead, Tony.
They asked if the residency was all 101 level courses.
So the question is whether the residency is all 101 level courses. What we've tried to do is actually move the 101 stuff to the prerequisites. So I think certainly there'd be some people who are pretty well advanced who might find some of the content basic. I guess I would say that the real key to it, though, is and we were able to accomplish it this last time because we stayed on time. We were able to have really good table discussions in that 1:8 chief resident to resident ratio, or the other way around, No, actually I got it right this time. 1:8 chief resident to resident. And so there was a good discussion on on ways that these tools can be applied within as part of a comprehensive plan and development of a plan. So I'd say it's probably more in it's moving toward the 201 level anyway, and setting the path for growth. Other questions here or on Twitter?
Are you starting to see senior leaders at the residency?
Are we starting to see senior leaders the question is, are we starting to see senior leaders at the residency? Well, we definitely are seeing some physicians. In fact, Dr. Mary O'Connor, who I believe is tweeting today, was a participant from Jacksonville in the course. We've had administrators from clinical departments. I don't think we haven't had Dr. Noseworthy or Dr. Decker or someone at that level, but we definitely are getting administrators and physicians among the participants. Yes?
Yeah, I want to know the Tony presentation. How long did it take to put that app together?
Come on up, Tony. And maybe if Michaela
The question was how long it took to put the app together. We use a company called Cadmium CD. They're an external company, not part of Mayo Clinic, to put the app together. But the work on my part really depends on how complicated the course is and how many days it is. But I would say it probably takes 3 to 4 hours on my part to fill out, and it's an Excel spreadsheet. This is probably more than you need to know, but it's an Excel spreadsheet that I fill out that has all the information on it, the full schedule, who's talking when, the names of all the presentations, the learning objectives for the presentation. So it takes me 3 or 4 hours to fill that out probably, and then they actually upload it into their system, and then I can work on the back end, add the PowerPoint presentations in. So 3 to 4 hours for pre-work, and then probably another 2 or 3 to upload everything, and then maybe another hour to kind of review things beforehand to make sure they're okay.
other questions on any of the presentations? Yes.
A question from Twitter for Tony. Do you have a published list of all the resources that you had mentioned?
I can put that definitely in the, are we doing the slide share?
Yeah.
Yep, I'll put that in the presentation. We'll make it available to you.
And I guess one thing that I would, so just a little bit of follow-up on that question about the 101 nature, or is the residency 101? I think part of the goal is to move people as quickly as possible through the 101 into the more advanced. That's why we have the prerequisites. I think some of the feedback that we got from some of the earlier residency sessions is that we were having, just as we had real beginners, and we were having people setting up their Twitter account during the session, and maybe we'd go together watching with a volunteer creating their Twitter account. And that was frankly not valuable for people who are already engaged. And so the other thing that we're doing is trying to group our participants by experience level, so that within the table discussions, both by experience level and also their area of interest. So we try to put the physicians at the table with Dr. Tamimi, who's our medical director, so they have some commonalities. And then others who have similar job responsibilities, but we also try to overlay across that the experience level, so that those who are more experienced can be feeding off each other, so to speak. Not literally or anything, not like cannibals or anything, but so any other questions, either remotely or from the group here?
About how many folks on the Mayo Clinic social media team?
Okay, so on the social media team we have, it gets a little complicated, but we introduced Elizabeth Hardy to you earlier. She's on our internal relations team, but also sits with us and spends about 40% of her time with us. We have, when we created the Center for Social Media, we got authorization to hire 8 people to be part of it. So it's in the sort of rounding, including that we get parts of people and their time, it's in the 10, 11 range.
Leila about, did we do any benchmarking with other organizations who have traveling exhibits to learn from their experiences, or did we just make it up as we went along?
No, we did some benchmarking as well. Good question. We actually have a colleague here now that had done some in the past in another organization, so definitely valued her expertise in recommending things, and I'm sure different aspects as they put together the exhibit that they definitely took people's feedback, such as the vendor who helped create the exhibit. Certainly that's what they do, so has created it for a lot of other places, but. I'd say from the most simplistic answer from a social media perspective, I think we even took away from NASCAR, right? So having the hashtag on a car or something that's traveling, it's your traveling hashtag now. You see it in Super Bowl commercials and on moving vehicles now, and so it's a great way to capture and to continue that conversation.
We had a question about if they're thinking about doing an advanced residency instead of a 101, 201 level.
So a question about whether we're thinking about doing advanced residency. Yeah, I mean, actually, we're having a team retreat next week, and it's 2 weeks from now. 2 weeks from now, we're having a team retreat. I think that's something that has come up previously, and it's something that we'll need to talk about because we now have had something like 500 people go through the residency program altogether. And so some of them have done it twice. And I think having a more advanced level makes a lot of sense. And so we'll have to, we have people both internally and externally who've been through it, and I think might find that helpful. Cool. Any final questions? Well, with that, I would like to thank everybody for participating here in person, and for those who've been watching on the web. Great. This presentation will be archived. We streamed it through YouTube. So the minute we hit stop, I think within a couple minutes, the whole video archive will be available. So please feel free to tweet it around to your friends and contacts and followers. We look forward to doing this again probably in a couple months, and we'll be working on that program. And so any suggestions that you have for speakers, whether internal or external, that could be part of this, we'd really appreciate it. Thanks for your time.
You guys are having a retreat up there?
Yeah, day-long retreat.
Huh?
Day long. So I'm going to fly out that afternoon. You said the last flight's at 16-year-old unsupervised for like 2 nights in a row.
So you mean coming back?
Yeah, it's 5 o'clock the latest flight.
Well, the one, Delta or US